All right, we will go ahead and get started. Good afternoon. Thanks so much for joining us. My name is Danae Aber. I'm the Executive Director of the Louisiana Rural Health Association. This is the Pricing Transparency, Noncompliance, and How to Fix It webinar. LRHA is happy to host this webinar presented by Amy Graham with Stroudwater Associates. This webinar is being recorded and will be available along with a copy of the slides on the webinar recordings page of our website within a couple of days. I will drop a link in the chat to the direct page for your convenience. Your line should have been muted automatically when you joined. Please remain on mute to prevent background noise. If you have any questions, please go ahead and enter them in the Q&A box at any time during the presentation. After the webinar, a survey should automatically open in your internet browser. We do ask that you please complete that survey. It's very brief, but it helps us to make sure that we continue to improve future events and identify future education topics that might be valuable to you. And so with that, I would like to welcome Amy Graham. Amy is an experienced healthcare executive providing vision and direction in finance and revenue cycle and serving clients in the pharmacy, laboratory, hospital, and rural health clinic space. She has over 20 years of experience in maximizing the accounting, finance, and revenue cycle processes for healthcare organizations. Her areas of focus include financial management and AR synchronization, RCM performance benchmarks and KPIs, AR management, claims process and submission, and rural health clinics. Thank you so much, Amy, for being here today, and I will hand it off to you.
Thanks, Danae. I appreciate the time to speak with everyone today. And yes, price transparency, non-compliance, and how to fix it. So I've got some experience here with several clients and several of my friends who have had to go through this process, and just wanted to share that with you, the experience that we had, so you have a little bit more insight into what is going on and things like that. So with that, we're going to talk about first just explaining what price transparency is, just helping everybody to get on the same page, make sure that we understand that this is what I'm talking about when I say price transparency. Then I have tales from a small hospital where they experienced the violation notice, where they received it, what they went through, and then the steps that we did to remediate that, how to address the violation, and then also what's in store for the future. Because right now we are waiting for the 2024, the OPPS ruling that will go into effect on January 1st of 2024. And in that, there are several items related to price transparency that I just wanted to bring to your attention to make sure that your facility may already have something set up, but that you're aware of what's to come in the future. Now, I did want to learn a little bit about my audience to begin with. So what I thought I'd do is have a few poll questions. So Danae, if you'd fire off the first poll question there. The question is how you would rate your involvement with price transparency at your facility. You have no involvement, you provide oversight only, or you own it. Looks like we've got the majority of the votes. If you want to share the results then, Danae. All right, so you can see that the majority of the people on the call today are providing oversight only. So that helps me understand a little bit about just sharing the information with you. And Danae didn't mention it at the beginning, but if you would like to go ahead and ask questions as we go through this presentation, feel free to just either send it through in the chat box, and it could be that Danae, yeah, I would say send it through in the chat box and we will get your questions answered for you. All right, so we will go on now. I need to get back to, like, Zoom is flaking out on me. So there we go. So what is price transparency? So this really all started back in November 15th of 2029 when CMS finalized the current year 2020 hospital outpatient PPS policy changes and payment rates and ambulatory surgical center payment system, policy changes, and payment rates. Price transparency requirements for hospitals to make standard charges public. CMS 1717-F2. We're going to call that price transparency if you don't mind, so I'm not referring back to that. It went into effect on January 1st of 2021. It's required from all licensed hospitals in the United States. So if you are a licensed hospital, you are required to post this information out there. It's done through 2 ways. There's a comprehensive machine readable file, so you'll hear me talk about that. And then there's also a display of shoppable services in a consumer friendly format. And when they talk about shoppable services, these are typically services that can be scheduled in advance. Now, why do we want to do this, or why are we talking about it today? Well, they actually did attach a monetary penalty to this, and that monetary penalty has been changed since it went into effect. Originally, it has been increased. And that civil monetary penalty is $300 per day for a hospital with a bed count of 30 or fewer, and a penalty of $10 per day per bed for hospitals with a bed count of greater than 30 days. So if you do the math, that fine, that penalty that a hospital could be fined for it is, upwards of $100,000 to millions of dollars. So just depending upon the size of your facility. So let's talk about these 2 files. The first file is this machine readable file. And what it includes are all the services and items, the charges for those for all locations that operate under a single hospital license. So if you think about it, that may be your main campus. But then if you have a provider's office, which operates under your hospital license, or you have a lab that's operating under your hospital license as well, these standard charges must be posted for those locations as well as for your main campus. It needs to be posted in a publicly available website, meaning that it's somewhere that the public can find, they can access it. There are no barriers, and those barriers could be things where using CAPTCHA to see if you're a human or not. It's got to be publicly available without barriers. It needs to be digitally searchable so that people can go in and search for this information. Updated at least once annually. It follows a standard naming convention for that file. And then it has data elements there. One of the things I'd like to point out is that it asks for a payer-specific negotiated charge. Now, in my world, in revenue cycle, when I think about the charge, I'm like, well, that's the price we charge for services, right? Well, in the case of the price transparency, when they talk about a negotiated charge, that's the amount that the hospital has negotiated with a third-party payer for the service. So each charge has an associated amount with it, and it's part of their fee schedule. That's the amount that they are expecting you to provide on this machine readable file. So it's just the information that's listed out there. Here's the charge. Here's the amount per payer that you're going to be paid for that, as well as a cash price. On the shoppable services file, this is actually different from that comprehensive machine readable file. This file, the shoppable services, includes 70 CMS specified shoppable services that are provided by the hospital, and then as many additional services to get to a total number of 300. So on your shoppable services file, you would need to make sure that you're including the 70 CMS specified services, things like a comprehensive metabolic panel. Another item that is out there is a CT of the head or a CT of the abdomen. So when you think about these services that are in shoppable services, these are things that patients would look for. They're going to want to find out the price prior to those services being rendered. So this needs to include, again, all of the locations that are under your hospital license, posted out there on an available website without barriers, digitally searchable, updated annually, and CMS has provided the option to have a patient estimator tool as an approved option. So if you have worked with a vendor, there are several vendors out there who are providing a patient estimator tool for you that does take the place of you posting a shoppable services file out there. Now, the shoppable services file does actually include different elements or additional elements that are not included in the machine readable file. The first item that's out there is the ancillary services connected with that identified service. So I mentioned that comprehensive metabolic panel, the CMP, a minute ago. And when you think about that service, do you also need to include any venipuncture charges that may be done? Some facilities may call that a blood draw. If you charge for that blood draw in addition to the test, both of those items need to be included with the item comprehensive metabolic panel. That needs to be included. When thinking about the CT of your abdomen, when looking at the CT of your abdomen, is that with contrast or without contrast? Do you charge for that contrast? Do you not? Is there a radiologist fee that goes along with it? When looking at the shoppable services file, you need to make sure that you're including those services in the amount that you are including with that identified shoppable service item. So you would have a CT of the head, and then underneath that you would need to say, here is the amount for contrast that we charge and the associated reimbursement amounts for the payers. And then, like, if there is a radiologist charge, you may not be the radiologist and have the pricing for them, but you would need to indicate that that service does include that so that the patient would know that they need to expect that they will receive an additional charge for that shoppable service. So now I'm going to kick it off and hand you another poll question. So Danae, can you kick off the question about my hospital's offering was last updated? If you know when it was updated. Your choices are in the past 90 days, in the past 6 months, in the past 12 months, or over 12 months ago. All right, let's see what our results are. So it looks like 50% of you have updated it in the past 90 days, and then the other half of you have updated it over 12 months ago. Well, I want to give you tales from a small hospital. So let's talk about my friends. My friends are at Allegheny Health. It's a 25-bed critical access hospital in Sparta, North Carolina. And I like to, when I mention Allegheny Health, I do have other friends that have experienced this same thing where they're not just paying attention to the big hospitals, they are actually looking at critical access hospitals as well. So Allegheny Health, they had their shoppable services that were posted using an estimator, a patient estimator tool. And like many other hospitals out there, they struggle to identify 300 unique shoppable services as part of their offering. And part of the reason why is because they have limited patient volumes and limited services. And so there was this day that they received a note from CMS stating that they had received a hospital price transparency warning showing that they were non-compliant with the requirements that were out there. So when thinking about this, I did want to ask you all, have any of you received a notice of violation or a request for a corrective action plan at your facility? I would say if you don't know, just check no. But if you do know, then I would say yes. All right, today let's look at our results. So it looks like none of you have received a violation notice. That's nice to hear, to know that you've got that in line. I met with some hospitals in another state and presented this, and it was like a third of them had received a violation notice. So that was really unique and interesting to me. So let's talk a little bit more about this violation notice that they received. The violation notice, what happens is CMS actually evaluates hospital, goes out there and evaluates hospital compliance using several different methods. One, they go through and they audit your hospital's website. They evaluate if there are any complaints that are made to CMS, and then they also review an individual's or entity's analysis of noncompliance. So there are organizations that are out there reviewing your website to come back and say, hey, go check on this company because I don't think that they're in compliance. Now, my friends at Allegheny, they received a notice on a Tuesday in November, and this notice stated that the review of the hospital's website had occurred on the previous Wednesday. So when thinking about these violation notices, they don't waste any time between the point at which they are reviewing your website and then if they are issuing the violation, they are issuing it within, in this case, within 7 days, the hospital had received that notice of violation. Now, the specific violations that they received were actually provided in the letter. It said they had a violation for not posting the machine readable file, and there was a violation related to the shoppable services, specifically that there was no consumer friendly list of standard charges that was found. And in this violation notice, they were given 90 days to remediate the violation. And so let's talk a little bit more about this enforcement. There were actually guidelines that were issued on April 26th of this year where where CMS said, you know what, we're going to change the enforcement of this rule and we're going to make it a little more stricter, where they have stricter timelines saying that you must have it done within a certain period, and they are levying fines more quickly. The process includes a notice of violation, which is a 90-day window in which the hospital gets to remediate the issue. And then if they don't meet the guidelines from that notice of violation, then they are given a corrective action plan. And that corrective action plan says that you've got 45 days to get your corrective action plan in and that you will be in full compliance within 90 days. Now, I will say what they also strengthened in these new guidelines on April 26th is it used to say, hey, you notice a violation, you go through that 90-day period, and then you go to corrective action plan. However, in April, they changed it and said, you know what? If this hospital hasn't even attempted to comply with pricing transparency, we're going to skip the notice of violation portion of it and go straight to corrective action plan. And I was at a conference just recently, and at that, I got to meet the ladies who were actually, and there were two ladies who presented. So two of the team members who are actually responsible for enforcing the hospital price transparency. And the one thing that they would say over and over again is, you know, we're looking to see, are they making any attempt to meet the requirements? Are they trying to satisfy that requirement, or are they just ignoring what's going on? And so, they kept sharing that with us to say, we just want to know, are they trying to meet it? Have they hit some hurdles? What's going on? And so when you receive that notice of violation, they're like, if they have any questions, they can call us. We'll be more than happy to, help direct them if they have their questions and answer anything that we can. But I will tell you, when you get that CMS violation notice, immediately you're like, oh, crud, what do we do now? You're like, who can help us remediate this issue? And, is 90 days going to be enough time to complete this project? And if we do have to remediate the issue, what's this remediation cost going to be for all my CFOs in the house? And then the $300 a day fine is a substantial fine for a critical access hospital. And then if you think about if you are at a larger facility, if it's $10 per bed per day, how many beds do you have in your facility? And start doing the math. And remember, they actually thought that they were in compliance because they were using a free tool that had been provided to them. And in the beginning, when price transparency came out, people would always ask me, they'd be like, Amy, is this really going to happen? Is this really going to stay? And I will tell you that back in the day, I didn't know because I hadn't seen anyone being fined. However, I can tell you today that it's not a threat. It really is a reality. That this was when I was putting this deck together, these were just three of the headlines about hospitals being fined for not following the price transparency rules. So it's not going away. It is something that is going to be out there and will continue going out there. And in a later slide, I've got some updates as to the things that they're asking for future iterations of your machine readable file. So let's talk about this violation. Mentioned it a minute ago, and I want to come back to it and say, when you get this notice, it's a little bit scary. So one of the first things that Allegheny did is they reached out to a partner who's familiar with their facility and pricing transparency. So I had just been working with Allegheny on a CDM review for them, and they're like, Amy, you understand what's going on, with our charge master. Do you have familiarity with price transparency? And I'm like, yep, got you covered. We can work on that. And so they formed an internal task force to support the completion of this project and getting it done and working with me. And then one of the things they really had to do, though, is to acknowledge that this one size fits most model that they had been using for price transparency didn't meet their needs. And so we really, together as an internal task force and acknowledging that what they had before wasn't working or didn't work, and we got together and started working on a compliant offering. And this compliant offering had two parts to it. We had to do the shoppable services offering as well as that machine readable file. So we started on on the shoppable services piece because that's where we would go through and identify 300 total services that needed to be included on this list for the hospital and clinic charge masters. So they had a clinic that reported up under their hospital license, and we needed to make sure that everything was included. We then started engaging the clinical team for the associated ancillary services. So most of you answered that you have oversight to this process. You're not actually in there doing it. And so when we would work with the team who was putting together the shoppable services offering, it would be like, well, do they use contrast or not? Do they charge for a venipuncture? What about this one? Do they charge for supplies? And in looking at those services, we really needed to engage the clinical team to help us answer those questions that they may have about, the services that are being provided and all of the ancillary services attached with that. Was there a provider charge? Would the provider charge for it? Was it a hospital provider, an outside provider? How did that look? Then we also analyzed the payer contracts for payer-specific negotiated rates. Now, I will tell you, this was the one piece that I have looked at and read the regulations back and forth, and they are looking for payer contracts that have payer-specific negotiated rates. So some of you may be looking at it going, well, we need to include every payer that might come to our facility. And the answer is really, for price transparency, you only include those providers where you have a negotiated rate. Yes, they may send you a lot of work, but if you don't have a contract, or you may see a lot of their patients, but if you don't have a contract with that payer, then they do not need to be included in either your shoppable services offering or your machine readable file. And so then what we did is with that shoppable services, we had the payers that were that they were contracted with. We had the services that we would be provided with all the ancillary charges. And we worked with them to develop an Excel model that they could post on their website. Well, it's not something fancy. It's not, it's just something that here is where a patient could go and say, I have Blue Cross Blue Shield insurance. What would my insurance, straight Blue Cross Blue Shield, what would they reimburse me for this? Then we took all of the work and leveraged the work that we had done in building that shoppable services offering to create the machine readable file. So again, we had our payer contracts because we had pulled it for the shoppable services offering. We could pull the entire hospital charge master, and we were able to populate that information and develop a CSV file that they could post on their website. And I will say to you that we were able to get both of these files created, completed, and posted online in under 60 days from that date of initial notification. So our goal was by the beginning of the next year, we were going to have that behind us. And we were able to do that. That when we celebrated the new year, we celebrated the new year and posting it online. And then where we called them and we said, what do we need to do? And we waited. We waited for the stealth ninjas to return. The group of individuals that works with pricing transparency violation, they're like, thank you for letting us know, but we will put you in our process and we'll come back and review your website again to see if you have any violations. And so then we received a notice of violation and a corrective action plan. And we were like, what did we do wrong? And it was 90 days from the first notice. CMS performed that second review of the website and determined that the hospital remained non-compliant. And the violation that was found was not with the shoppable services offering, but rather was with the machine readable file. Because the way their system pulled, their room and board charges were not included in that file that we had received. So when we posted it out there, we missed the fact that the room and board charges were not included. So we got those quickly added. But then look at this next violation they had. The violation was related to failure to follow the naming convention specified by CMS, which is the EIN underscore hospital dash name underscore standard charges dot and then the file format of a CSV. I'm going to stop here and stress CMS gives us a lot of flexibility right now as far as what these files look like and what the format is. But what they do not give flexibility on is in the standard naming convention. Yes, this happened at Allegheny, but I can list out the names of at least 4 other hospitals that did not have it named correctly, and they received either a corrective action plan or a notice of violation to let them know, or corrective action plan request or a notice of violation to let them know that they were in violation of this. And it's interesting to me because I've worked with other hospitals and it's like, what do you mean? And what for you, if you want to go back and check it on your hospital's website, go to your hospital, look at your machine readable file. And then when it downloads, that download file name needs to be in this format that is shared here on the screen. Don't put any underscores except between the EIN, the hospital name, and the standard charges. If you put an underscore in the hospital name, that will be a violation. If you put a dash between the EIN and the hospital name, that is in violation. So just know they are very particular. When I spoke with the ladies who do the review of it, they're like, yes, it must be in this standard naming convention. So going back to my friend's Allegheny, there were no violations on the shoppable services file, and we were given 45 days to complete and submit the corrective action plan. They give you, it does have a file name, a file number attached to it. So you attach that file number to the file name itself when you're submitting the corrective action plan. You send it back to them. And at Allegheny, we were able to add the room and board charges, change the file name, get it changed on the website, and get all of that done in 3 days. And then what happened? Well, we waited for the stealth ninjas to return within 30 days. They did come back and issued a compliance notice to Allegheny. So Allegheny made it through that second review. They did get a letter back that said, we have been, you are in compliance as of this date, the date of our review. And, know that we have completed your corrective action plan. or accepted your corrective action plan. So some of the key learnings that we had out of this whole process were that it's not just meant for the large institutions. Both rural and critical access hospitals are not exempt. They also are looking at behavioral health facilities. What does that look like? And they are paying attention to you. The comprehensive machine readable file and the shoppable services file, they contain similar information. Price charges for the specific payers, the maximum and minimum negotiated rates, but they also include unique information that needs to be provided in the files. For example, your standard room rate needs to be included on your machine readable file, but not on shoppable services. CMS does provide flexibility in the format of the file, but the standard criteria must be met. And remember, incorrect file naming convention and omission of the last reviewed date will cause a violation. And when I mentioned that last review date will cause a violation, I had a friend of mine that they had it posted out there and they're like, Amy, we got this letter. What's wrong? And I'm like, well, you've got all the information posted out there. But when we went back and looked at it, the date of the letter was dated in March of this year of 2023. However, the last time we had reviewed the file, or the hospital had reviewed the file and updated it online, was January 1st of 2023. So there were 45 days that they had not performed any updates in the system on their shoppable services file, and the machine readable file, and that caused a violation notice to be generated. So I would say go back and look. What was the last reviewed date? Have you done any price changes? Even if you have not done any price changes or signed any new contracts, you do need to update the date on your file itself. And then just know that resources are available to provide support. You don't have to solve this alone. If you receive a violation notice, feel free to call me and just be like, Amy, what are they saying? This looks like a whole bunch of gobbledygook. And I'll help you, connect it. Or to also call the phone number that they have listed on the letter and ask them questions. They stated more than once. It was interesting because Danae and I both attended that meeting. And that was one of the key takeaways she had with it as well, to say, just give us a call. Let us know what's going on. Let us know that you've received the notice of violation, that you are working through this, just to help us out. So those are some of the key learnings that we had through this violation process. But I do want to talk to you a little bit about what's in store for the future, because I've talked about how it is as of today. However, I'm expecting that while the violation and corrective action plan process won't change, there will be changes for the machine readable file in the future. So today I've got another question out here, that on a scale of low being 1 and 5 being high, how concerned are you about the future of price transparency? All right, it looks like we've got it out there. And looking at the results, it looks like half of you are, in the middle. You've got some concerns, and then the other half of you are very concerned about it. So let's kick off the next question out there. The next question is, I am aware of the proposed changes to the comprehensive machine readable file. Are you aware of what I'm talking about? Things that might be changing. All right, looks like half and half again. All right, so if we look at the changes for next year, what they have out there related to the 2024 proposed rules are that they are looking to promote standardization of the data. Remember before I was telling you that machine readable file, that you could do it in whatever format you wanted and putting the information out there. Well, that information is actually, they are looking at having a standardized format. So they want to have standardization of the data and enhance the accessibility for organizations and for people to be able to look at it and compare it between hospitals. They're also going to look at requiring additional fields, meaning that they're looking at requiring hospital data and version numbers. Like, okay, here's the information for our hospital. Here's the location where it is. We perform this in our clinic number 1, but this is in clinic number 2. And this is performed in the hospital. Just where within the location of your facility, location of your facility, where the services are being performed. And then if there's a version number where you could be working on it today, and today it's version 1, and then this afternoon you go back and look at it and go, oh man, we need to make changes to this. It's got version number 2 of today's date. One of the things that they are also asking for are payer-specific negotiated charge class clarification as to how the charges should be interpreted. Is it a package service, so they're going to pay a single amount for all of the services that are out there, or how should those charges be interpreted? They're also looking at adding additional hospital items or services being provided and any additional modifiers to it, really looking at modifier combinations. Some of the things that they're also looking at changing with the 2024 proposed rule is that hospitals are required to formally acknowledge the receipt of the initial warning notice. So while you may have said, hey, I haven't received a notice, is it that you haven't seen one, or could there be the potential that it got lost in the mail? Because the ladies who do perform this have shared that some people, that notice didn't get to the appropriate party. So now the hospitals are going to formally acknowledge that they have received that initial warning notice. One of the other items that is going to be out there is that the hospital must now certify the accuracy and completeness of the information that is being posted. So very similar to how as someone from administration or someone has to sign off and certify that your cost report data that you're submitting is complete and accurate, they will be doing the same thing related to the information, or they're proposing that you would do the same thing related to the accuracy and completeness of the shoppable services and machine readable, comprehensive machine readable file. And then the other item that they're proposing for 2024 is that that when CMS takes an action against a hospital, not just if they're assessing fines, but if you do a warning notice or request for corrective action plan, that CMS will then publicize who they are working on, so that then more people can have awareness to what is going on with a facility to see if they've received that warning notice or request for corrective action plan, or even been assessed a fine. So those are things that are out there in the 2024 rule. These are the proposals. Wanted to just share them with you. I don't know how that's going to fall out with the ruling for 2024. So more to come on that. I am actively watching to make sure. I was apologizing to Danae earlier that I hadn't sent the deck to her, because it could have been that they finalized that ruling, and with the finalization of that ruling, I could change this slide from draft to final. However, that's not the case. We are still in the draft mode, waiting to see what that's going to look like. Wanted to just make you all aware of that this is out there, that it's not going away. And then some of the things they are also talking about are when this will go into effect. So if it becomes a live rule as of January 1st, is it required to be live on January 1st, or is there going to be an implementation time? When you think back to when the original rule went out, it was finalized in November of 2019. It was supposed to be in effect in March of 2020, but because of the pandemic and everything, that deadline was extended to January 1st of 2021. So I don't know if they will have that 90-day grace period again, or what that's going to look like. So these are some of the things that we are waiting to see and don't have any formal ruling on. Excuse me, but if you all do have oversight of that project, make sure that you're aware that there are changes that are proposed to be coming down the pipe for next year. So some call to actions for just looking at price transparency. The things that you can do today is you can review your price transparency offering. Make sure that shoppable services and your patient estimator tool, that you can find things out there. I will tell you, the one I always go looking for is a colonoscopy. It's CPT code 45378. That is one of those required services that's out there, and I always go to see, do they offer that? Is it noted that they don't have that at the hospital? How do they handle that? What is that looking like? Can I find it in the patient estimator tool? And then also, when looking at the comprehensive machine readable file, the things I look at are, is it in the standard format, naming format? Because that'll get you a violation before they ever open it up to see what the data is on the inside. So you want to make sure that you have that in the right naming convention. And then what you want to also do, a call to action, is to inform your appropriate team members on how to handle any CMS violation notices that you may receive. Does your team know that when something comes in with the CMS letterhead, where it needs to go to? Does it always go to administration? If it always goes to administration, does administration know who to reach out to on your team regarding this pricing transparency offering, and who is responsible for that? If you're providing oversight, do you have that phone call that you can call to get the information updated on your website? What does that look like? Those are things that you can do today. And then watch for HFMA. They actually are very good at posting updates out there on the 2024 final rules. In addition to HFMA, CMS will post it, as well as a lot of different industry organizations do post updates to the 2024 final rules when those become finalized. And I will also be looking at that. So if you have any questions, you can feel free to reach out to me. So with that, I'm going to open it up for any Q&A to see if you have any questions. And again, you can put it in the chat box and send it to me. Or I don't know, did they have the option to taking themselves off of mute?
I don't think so. I think it would have to be in either the Q&A box or the chat box.
Okay.
So yeah, while we wait to see if anybody has any questions, please feel free to pop them in there. I will say, Amy, you mentioned the TA folks at CMS that are helping people with this, and that you had met with them at the conference a couple weeks ago. One of those ladies is someone that I've worked with for a long time. She used to be on the rural health side. And so I know her really well, and had a good conversation with her at the conference. And they continue to stress that they personally, individually, really want to help our providers and our rural hospitals in particular, in making sure that they don't get to the point of any kind of monetary penalty. And so, she's got a lot of rural experience and a big heart for rural. So, they definitely want to help you out. But it's, if hospitals are in non-compliance too long, and it goes beyond their control to really help, and it ends up in the monetary penalty phase, and that's outside of their control. So the earlier you can work on any kind of, if you do get a violation letter or non-compliance letter, the earlier you start working on that, the less likelihood that you're going to face some monetary penalties there. So they were definitely encouraging people to reach out.
And I'll go on the record to say, I walked into that presentation going, these ladies are they're not the enemy. They're not the enemy. And by the end of it, you really did know that they cared, that they don't want to assist the fines. They want to do whatever they can to help your facility out. That they are the ones who are analyzing these websites. They're not the legislators who put it into place. They didn't make the rule, they just get to enforce the rule, but they will work with you. And I really respected that and appreciated the fact that they were the nice ninjas out there, not the evil ones. So with that, I was just really grateful for that and appreciated all of the hard work that they have to do looking at these day in and day out. And I will also say, in the appendix to this slide deck, if you're wondering what those 70 specified shoppable services are, I have a page that lists them out where it's with the different categories of evaluation and management codes. You have laboratory and pathology services, radiology services, medicine and surgery services, and then additional medicine and surgery services. And it could be that even if you look at like items number 41, 42, 43, where you've got spinal fusion or major joint replacement, that when you look at these, you may say, we don't provide those at our facility. While you may not provide them at your facility, you do need to notate that you don't provide it at your facility. And then for those items that you don't provide, you need to add an additional code to get to a total number of 300 individual line items that you are providing pricing for. So if you're wondering, I did mention like the CT of the head, CT of the abdomen. You see that information posted out there, as well as your basic metabolic panel, and then other services that you would shop for. So that's listed out there in the appendix for you as well. Here is my contact information. If something does come up and any questions you may have, do feel free to reach out. My family is always grateful when people reach out to me and ask me about revenue cycle questions. Instead of me talking to them about it, I get to talk to you about it. So do that. I appreciate that. And that's all I have for today, Danae.
Yeah, and not seeing any questions, we'll go ahead and roll into our closing here. So thanks so much, Amy, for joining us and sharing your knowledge, and thanks everyone for joining us. As a reminder, as you exit the webinar, a brief survey will open in your internet browser. Please do take that for us. The webinar recording, along with a PDF of the slides, will be on our website in the next couple of days. And as always, please feel free to reach out to LRHA if we can be of any assistance. And thank you so much and have a wonderful afternoon.
Have a great day. Bye, everyone.
Bye. Thank you.